Hello everyone, I'm John Paul. Today I would like to talk about the pelvis, one of the most important anatomical regions of the human body. So, the pelvis is a bony structure formed primarily by the two hip bones right here. As you call it, the oxa coxae together with the sacrum and the coccyx right there. You can see the highlighted. Each hip bone itself is composed of three fused parts: the ilium, the ischium, and the pelvis right there. These bones join anteriorly at the pubic symphysis and articulated posteriorly with the sacrum and the sacroiliac joint. So structurally, the pelvis supports the weight of the upper body when standing and provides stability during the locomotion. From a muscular point of view, several important groups are related to the pelvis. One of these is the internal surface. We can find the muscles, such as the abductor internus and piriform, which play a key role in the lateral rotation of the hip. In the pelvic floor, we have the levator ani groove formed by the pubis rectalis, pubis coccygeus, and iliococcygeus, along with the coccygeus muscle. You might identify it right there. This is the iliococcygean muscle. You can see highlighted right there. You can see the pubic coccygeus muscle, interpubic muscle, and iliococcygeal muscle, and below you can see the levator, the anus, pubis rectalis, pubis coccygeus, and iliococcygeus muscle. Along with the coccygeus muscle, create a supportive diaphragm which then maintains the pelvic organic positions and contributes the continence. Externally, other muscles, which the gluteus maximum, medius, and minimus, and the tensor of facial area, are closely connected to the pelvic bones and participate in the hip movement. Now regarding innervation, the pelvis is richly supplied with nerves arising from the lumbosacral plexus. I'm going to show you. Some of the most important include the sciatic nerve. You can see it right there. It's large. Through the greater sciatic foramen below the piriforms, the parental nerves, which provides motor and sensory supply to the perineum, and the superior and inferior gluteal nerves, which innervates the gluteal muscles. Additionally, autonomic fibers from the pelvic splenic nerves contribute to the innervation of the pelvic organs, being essential for the pituitary functions. And in summary, the pelvis is not a bony basin, but a complex anatomical region where the bones, muscles, and muscular nerves interact harmoniously in this function range from the supporting the trunk and enabling the locomotion to protecting the pelvic organs and providing passage from neurovascular structures without the structural functional integrity of the pelvis. Bowel stability and vital organ functions would be separately compromised. When we study the pelvis, it's equally important to understand not just anatomy, but also common disorders and pathologies that can affect bones, muscles, and nerves, respectively. From the body from the bony perspective, fracture of the pelvis is significantly clinically concern. This often results from the high energy trauma, such as cars accidents, and can involve the public remi, secure lucky joint, or even the acetabulum, such a fracture might compromise stability and can be associated with the served internal bleeding due to the rich vascular supply in the region. Another important condition is the osteotis pubis, which is an inflammatory process, then the synthesis of the pubic offenses in athletes normally. Regarding in the muscular system, the pelvic floor can suffer from weakness of injury. One of the most common conditions of the pelvic floor dysfunction, which may lead to urinary incontinence, fecal incontinence, or pelvic organ prolapse, and um, or in pregnancy commonly. This frequently affects women and the childbirth, but it can also appear in men, especially after a prostate surgery. Additional response of the muscles like the perforance can cause compression on the sciatic nerves, leading what it notes it a piriformis syndrome. It's kind the inflammation of the muscles. When it comes to nervous structures, several pathologies are notable. The sciatic nerve can be compressed, not only the peripheral syndrome, but it also near intervertebral nerves, intervertebral tics, producing sciatica with pain right down the lower limb. The pudendal nerve can be affected in the intraplumbment during the pudendal neuralgia, which manifest as a chronic pelvic nerve and discomfort in the perineal region. Autonomic dysfunctions of the pelvic splenic nerves might also contribute to the problems such as urinary irritation or sexual dysfunctions. In summary, pelvic disorders are diverse and can involve bones, muscle, and nerves simultaneously. They often present with pain, instability, or functional impairment, and require multidisciplinary approach from diagnosis and management. Understanding these conditions highlighted the clinical importance of the pelvis beyond its structural anatomy. That's all.